40 million Americans are quietly losing brain tissue right now. Not from a stroke, not from a tumor. From the food gaps nobody warned them about. Gaps so ordinary they don't feel like gaps at all. Most people over 60 have heard that calcium is good for bones, that protein builds muscle, that eating vegetables matter. They've heard all of it. And they're still losing muscle at 3% a year. Still watching their memory slip. Still getting told their bone scan came back a little low. The problem isn't the advice. The problem is what's missing from it, and why 3 specific foods, ones most Americans ignore or dramatically underestimate, are doing something the science is now calling remarkable. I'm an emergency medicine physician. Most of what I see in my ER wasn't inevitable. It was quiet and building for years before it arrived in front of me. The falls that end independence, the fractures that turn into something far worse, the memory loss that no one caught early enough to change the direction. Today, I want to go upstream. I want to show you 3 foods, what they're actually doing inside your body, and why understanding that mechanism changes what you do next. By the end of this, you'll know the most underrated brain protective compound in the American food supply, why the way most people take calcium supplements is actively working against them, and how the protein math most people use is completely wrong after 60. Let's start with the food most Americans have never eaten. When was the last time you heard someone talk about rosmarinic acid? If the answer is never, you're not alone. And that's a problem, because the evidence around this compound and brain health is some of the most compelling I've come across in years. Rosmarinic acid is a polyphenol, a plant compound found in rosemary, basil, and lemon balm. But the plant that concentrates it most densely is one most Americans have never tasted. It's called Perilla leaf. In Asian cooking, it's used the way we use lettuce, as a wrap, a garnish, a side dish. Here, almost nobody has heard of it. Here's what it does inside the brain. Your brain communicates through chemical messengers. The one most directly connected to memory is called acetylcholine, the electrical spark that lets one neuron talk to the next. When it's clear and strong, your memory works. When it degrades, connections weaken. Memory gets patchy. Focus drifts. There's an enzyme in your brain whose entire job is to break down acetylcholine. In a healthy brain, the system is balanced. But in early cognitive decline, it tips. The enzyme becomes too aggressive, clearing the signal before it lands. This is actually the mechanism behind Alzheimer's medications like donepezil. They slow the breakdown of acetylcholine to keep more of it available. What rosmarinic acid does is similar in direction. It inhibits that same enzyme naturally. It also crosses the blood-brain barrier, meaning it actually reaches the tissue where it needs to work. A 2023 analysis in the journal Nutrients found that dietary polyphenol intake was inversely associated with cognitive decline in adults over 60. Compounds in the rosmarinic acid family were among the most promising candidates identified. 1 gram of dried perilla leaf contains about 76 milligrams of rosmarinic acid. That's 7 times the concentration in rosemary. The density is genuinely unusual. Now here's the part most people don't know about calcium. In this country, the standard response to bone density concerns is, take calcium. And many people do, faithfully, for years. Then their next bone scan comes back the same, or worse. The issue isn't always the calcium. The issue is routing. Calcium doesn't independently decide to go to bone. It needs a trafficking system, a protein called osteocalcin, to pull it from your blood and deposit it into bone matrix. But for osteocalcin to work, it needs to be activated. And the thing that activates it is vitamin K. Perilla leaf is a dense source of vitamin K. Without it, the calcium circulates, but the routing system is sluggish. You can take calcium every day and still have poor bone density if the vitamin K piece is missing. If you've been taking calcium supplements for years without seeing results, before you assume they aren't working, ask your doctor about vitamin K levels. It's not a commonly tested nutrient, and many older adults are deficient without knowing it. One caution: if you're on a blood thinner like warfarin, Talk to your prescribing physician before significantly increasing dietary vitamin K. Large fluctuations can affect how the medication works. Small, consistent amounts are a different matter, but that conversation is worth having. In the United States, fresh Perilla leaf is most reliably found in Korean and Japanese grocery stores. It looks like a large basil leaf, tastes more complex, slightly minty, with an anise edge. Use it as you'd use basil. Wrap it around grilled fish or chicken, tear it into salads, add it to rice bowls. The nutritional density is best raw or lightly cooked. And one combination worth knowing, Perilla with egg yolk. Egg yolk is one of the richest dietary sources of choline, the raw material your brain uses to produce acetylcholine. Rosmarinic acid protects acetylcholine from breakdown. Choline increases its supply. Two mechanisms hitting the same system from different directions. Now let me tell you about the protein mistake most people over 60 are making. She was 72. Her name was Carol. Her blood work had come back fine 3 months earlier. What brought her to me was a fall in the bathroom. Nothing dramatic, just a step over the edge of the tub where her leg wasn't where she thought it was. Fracture, left hip, surgery. When I sat with her afterward, she was eating reasonably, taking her calcium, exercising occasionally, no osteoporosis diagnosis, though her bone scan had been borderline. No one had asked her about vitamin K. No one had asked whether she was hitting protein targets. No one had discussed the per-meal protein threshold, a concept that has significantly shifted clinical recommendations in the last several years. Here's what that means. Protein is not the same after 60 as it was at 40. And I don't mean just the amount, I mean the timing. Your muscles respond to protein through a signaling pathway. In young adults, the system is highly sensitive. Small amounts trigger a meaningful rebuilding response. After 60, that sensitivity decreases. This is called anabolic resistance. You need a higher dose per meal to trigger the same effect. Research published in the American Journal of Clinical Nutrition identified what they call the muscle protein synthesis threshold for older adults. Approximately 25 to 30 grams of high-quality protein per meal. Below that threshold, you may be eating protein without triggering the rebuilding signal your muscles need. Think about what that means practically. If you eat 30 grams at breakfast, 30 at lunch, 30 at dinner, you've crossed the threshold 3 times. If you eat 10 at breakfast, 20 at lunch, and 60 at dinner, same total, but you've likely only crossed it once. Most older Americans don't come close to 25 grams at breakfast. Cereal, toast, maybe an egg, sometimes nothing. The CDC classifies this as a serious issue. Sarcopenia, age-related muscle loss, now costs the U.S. healthcare system more than $20 billion a year in fall-related injuries, hospitalizations, and rehabilitation. And protein distribution, per meal, is one of the most direct modifiable factors. The best sources for this are high in an amino acid called leucine, the trigger that most directly activates the muscle rebuilding pathway. Eggs, fish, especially whitefish and salmon, Greek yogurt, tofu and edamame for those who prefer plant-based sources. One practical starting point, try to get 25 grams at breakfast for 2 weeks. 2 eggs give you about 12 grams. Add a cup of Greek yogurt for another 17. That's 29 grams before 9 a.m. And it's the single change most likely to produce a noticeable shift in energy and muscle maintenance. If eggs and yogurt aren't your preference, a small can of tuna with some crackers gets you there. A protein smoothie with a full scoop of whey or pea protein and a cup of milk. Even cottage cheese with some fruit. The exact food matters less than the number. Hit the threshold. I hear this concern often, particularly from women. Doesn't focusing on protein lead to weight gain? Here's the clinical reality. After 60, inadequate protein is far more likely to change your body composition negatively than adequate protein is. As muscle decreases, your metabolic rate falls, and the same calorie intake that once maintained your weight now slowly adds fat. Protein is not the enemy of a healthy weight after 60. It may be the best protection against the body composition changes that make weight harder to manage. There's a brain angle here too. Protein provides the raw material for nearly every neurotransmitter your brain produces. Serotonin, dopamine, GABA, all synthesized from amino acids. When protein is inadequate, the brain competes with muscle for available amino acids, and the brain often loses. The downstream effects look like normal aging: brain fog, low mood, poor sleep, memory drift. Sometimes it's a protein gap. A 2022 study in JAMA Network Open found that lower dietary protein intake in adults over 65 was significantly associated with increased cognitive decline over 5 years. The quality of protein mattered, not just the quantity. Now, the third food. This one surprises almost everyone. Daikon radish is a large white root vegetable, common throughout East Asian cooking, available in most Asian grocery stores in the US, and almost never mentioned in mainstream American nutrition guidance. It should be. Here's the first thing to know. Raw daikon is a natural digestive enzyme supplement. Your body produces amylase and protease to break down carbohydrates and protein. As we age, enzyme production often decreases, which is one reason older adults experience more digestive discomfort and less efficient nutrient absorption. Daikon radish, eaten raw, contains high concentrations of both. If you've ever seen a Japanese meal, grated raw daikon almost always appears alongside grilled fish or meat. That pairing is centuries old, built on the observation that eating daikon made rich food digest more comfortably. The research confirms it. A 2021 analysis in the Journal of Nutritional Biochemistry found daikon's enzymatic content among the highest of common root vegetables and concluded that regular consumption could meaningfully support digestive efficiency in older adults. Heat deactivates these enzymes. For this benefit specifically, eat it raw, grated, or thinly sliced alongside your meal. 2 tablespoons grated is all it takes. Here's a pattern interrupt worth pausing on. Better digestion from daikon means better absorption of the protein you're eating and the polyphenols in perilla. The 3 foods we're discussing don't just sit next to each other, they interact. Each one helps the others work better. Daikon also belongs to the cruciferous vegetable family, the same family as broccoli and cabbage. Cruciferous vegetables contain compounds called glucosinolates, which convert in the body to biologically active substances, including isothiocyanates. A 2022 review in Cancer Epidemiology, Biomarkers and Prevention, published by the American Association for Cancer Research, found that higher cruciferous vegetable intake was associated with risk reductions in colorectal, lung, and bladder cancer of 20 to 40% across multiple large cohort studies. Let me be precise. Daikon is not a cancer treatment. It does not replace screening. It does not replace your oncologist. What the evidence does say is that long-term dietary patterns rich in cruciferous vegetables are associated with meaningfully lower cancer risk. Here's the mechanism in one sentence. Your kidneys respond to the sodium to potassium ratio in your diet. Sodium tells them to retain water, blood pressure rises. Potassium tells them to release sodium, blood pressure falls. Most Americans are running that ratio backwards. The AHA recommends 2,600 to 3,400 milligrams of potassium daily. Average American intake, roughly 2,300. That gap is widest in older adults, who are also the most likely to have high blood pressure. Daikon moves that ratio in the right direction. If you have chronic kidney disease, talk to your doctor before increasing potassium foods. That condition changes the math. One more thing about daikon that rarely gets mentioned. A compound called sinigrin stimulates the mucus-secreting cells lining your airways, producing thinner mucus that clears pathogens more easily. Centuries of folk medicine used daikon for coughs and congestion. The mechanism holds up. Not a treatment, but biologically sound. Practically, grated raw daikon as a condiment is a 15-second preparation. Asian grocery stores carry it for under $3 a pound. Keep it in the refrigerator and grate 2 tablespoons onto the plate alongside whatever you're eating. That's it. Stop for a moment. 3 foods, 3 mechanisms. And they don't just sit next to each other, they compound. Here's what that looks like in practice. Perilla leaf, rosmarinic acid protecting the brain's memory messenger, vitamin K routing calcium into bone, iron supporting oxygen delivery to the brain's tissue, protein distributed correctly, leucine triggering muscle rebuilding 3 times a day instead of once, amino acids feeding neurotransmitter production, structure for every enzyme and signaling protein your body runs on. Daikon, enzymes improving absorption of what you're already eating, glucosinolates supporting the body's carcinogen clearance pathways, potassium counterbalancing sodium's effect on blood pressure. They compound. Better absorption from Daikon means more benefit from the protein and Perilla. The vitamin K in Perilla routes the calcium your body is taking in. The choline from egg, which pairs naturally with both Perilla and Daikon in many preparations, adds to the acetylcholine system the rosmarinic acid protects. This is not a magic combination. It's 3 foods with complementary mechanisms that address the 3 most common drivers of functional decline after 60: muscle loss, bone fragility, and cognitive decline. Let me give you the triage framework clearly. If your primary concern is cognitive health, start with Perilla leaf and the protein distribution protocol. The acetylcholine system and neurotransmitter amino acid supply are the most direct dietary levers for brain function. If your primary concern is bone health, the vitamin K from Perilla leaf and adequate protein per meal matter more than calcium supplements alone. Ask your doctor about a DEXA bone density scan if you haven't had one, and ask specifically about vitamin D and vitamin K levels. If your primary concern is blood sugar or blood pressure, Daikon as a regular condiment, walking 10 minutes after meals, and the potassium contribution are the most relevant starting points. If muscle and frailty are your concern, 25 grams at breakfast every morning for 2 weeks. That's the single change with the most direct evidence behind it for this age group. On the medical ladder, monitor at home if you notice digestive discomfort, energy changes, or appetite shifts after dietary changes. Schedule an appointment with your PCP for memory concerns lasting more than a few weeks, unexplained weight loss, falls, even minor ones, or new bone or joint pain. Go to urgent care or call your doctor same day for a fall with any injury, sudden memory confusion, or new chest pain or dizziness. Call 911 for sudden severe headache, one-sided weakness, slurred speech, or facial drooping. Those are stroke symptoms, and every minute matters. Here's what I want you to carry away. Perilla leaf, densest common source of rosmarinic acid, protects acetylcholine, activates the calcium routing system through vitamin K, supports brain oxygen delivery through iron. Most Americans have never tried it. It's inexpensive and widely available at Asian grocery stores. Protein after 60, not the amount alone, the distribution. 25 grams per meal, high leucine sources, starting with breakfast. The threshold matters as much as the total. Daikon radish, natural digestive enzymes in raw form, glucosinolates linked to reduced cancer risk, potassium for blood pressure, blood sugar support. Under $3 a pound, grated onto your plate. The goal isn't perfection. It isn't doing all 3 at once. It's one useful step, taken in the right direction, from a better understanding of what's actually happening in your body. Pick the one that matches your concern. Try it for 2 weeks. Notice what shifts. And here's one more thing I want you to do, regardless of which of these you start with. For the next 7 days, track one thing, not your weight, not a number on a machine. Track how you feel in the 2 hours after breakfast, energy level, hunger, whether your mind feels clearer or foggier than usual, whether your digestion is comfortable or not. Most people have never done this deliberately. They've eaten the same breakfast for years and never connected what they ate to how they felt at 10 a.m. That gap between the input and the outcome is where most dietary changes get lost. If you shift your breakfast protein to 25 grams, You will notice something in the mid-morning window. Not because of placebo, but because protein has a measurable effect on satiety hormones, specifically GLP-1 and PYY, within 2 to 3 hours of a meal. That's why the protein at breakfast change is the one I suggest starting with. The feedback loop is fast enough that you feel it, and that makes it easier to sustain. 7 days, 1 change, 1 observation per day. That's the minimum viable experiment. Your body has been giving you information for a long time. Now you have a slightly better way to read it. I'll see you in the next one. If this kind of deep mechanism explanation is useful to you, consider subscribing. No supplement promotion, no miracle claims, just the real picture, explained as clearly as I can.